This is Local Edition. I'm Brad Pomerance at the state capitol in Sacramento. We are joined by the majority leader of the California State Senate. His name is Bill Monning. And as I drive through California, I'm amazed at how many times I see an establishment that is advertising for, I'll call them pet hotels. I'm not sure what else to call them. And I have friends who, at the beginning of the workday, they drop off their babies, and I don't mean their children.
Right.
They drop off their dogs at a pet hotel, and they have a great day, and then they pick them up.
Right.
But I understand recently there was a tragedy at a pet facility in Monterey, your district.
Yes, last year we had a tragedy in Monterey, a pet boarding facility where I believe it was 17 pets perished. There was one 2 years ago in San Luis Obispo County where I think 11 pets perished.
Also your district.
And it's also my district. And as we looked into this to understand, well, what are the regulations, we found out there are no regulations that regulate pet boarding facilities. We have them for pet stores, but not for boarding facilities.
Veterinary clinics, I presume.
That's correct. A veterinarian is licensed and held to certain standards, but no regulation of any kind for pet boarding facilities.
It's such a new business. I mean, 5 years ago, did they exist? I don't know.
Well, I think they've existed for a long time. I think what we've seen, and you allude to it, is the advent of pet spas, daycare centers, etc. So they've been a little bit more personified. But many families for years will leave a pet, and as you said, really a loved member of the family, they'll leave them at a boarding facility during their week vacation or 2-week vacation, and you entrust your pet with the belief that they're going to be well cared for, the place is well maintained, and that they've minimized safety risks.
Do you know if any of our sister states have adopted regulations in this space?
Not that I'm aware of. It's a fair question. We know they don't exist in California, and what we're doing is we're just trying to create a foundational set of regulation. We're using pretty much the model that's used for pet stores. And it would be under the supervision and control of animal control officers who are usually county employees. And so what we create is a complaint mechanism and a fining mechanism. And the reassurance that I think is important to offer here, we believe that most boarding facilities are well run.
And they want to treat these animals well.
And they do it because they also care for animals. What we're looking for is those who are cutting edges, who are cutting corners, and who are putting the pets at risk. And we want to empower the pet owner. If they believe that a pet has not been well cared for or that they've observed unsafe conditions, that they have a complaint mechanism to the county animal control officer who could impose fines, a first offense of $250, subsequent offense $1,000. But again, our goal is to make sure that the law-abiding boarding facilities are recognized as such.
Is there a private right of action, either now under the current law or as a result of SB 945?
We do not create a private right of action. We create a fining mechanism. It is regulatory. I think what we would find is that there's a current existing private right of action. If your pet perished in a fire, you would retain as a citizen. We certainly don't remove that right. If there's some tragedy, for a pet owner would have their own legal recourse. But what we want to create is a regulatory system where everyone knows what the rules are.
So have the counties spoken out about this? Because presumably it could be a bit of a burden. Will they need more officers as a result of this legislation? Is there funding for that? Or
fair question. Counties haven't weighed in through CSAC or on their own. We have been in touch with some of the counties in my jurisdiction, Santa Clara County. We've talked to some people with experience in both Morgan Hill and Gilroy who think it's a great idea and says it's long overdue. Let's get on with it.
What about, is there a pet spa association?
We will find out.
Once they hear this interview. Because look, I think it's important. You know this. Just make sure all the stakeholders are involved. And it seems as if you've tried to not create a whole new regulatory scheme, but just apply pet store standards to pet spas standards.
And so that's how we begin, and it will be informed. We're in the early stages. We've just introduced it, has not had a committee hearing. And as you know, the way the process works here is that it's a very open process in our committee process. We'll hear from stakeholders, and we're free, and I reserve the right to adapt, to amend,
always,
to address unforeseen, unintended consequence, or to further strengthen it to address the interests. Again, we want to protect the law-abiding folks,
of course.
Most importantly, we want to protect the pet owner and the pet. The pet is one of the most vulnerable residents, for lack of a better term, in our state. They have no voice except maybe a loud bark and maybe a bite, but they depend on us to create the circumstances for their protection and safety.
I want to shift gears and talk to you about a healthcare issue for humans.
Yes.
I think I may have told you, my wife has a chronic condition. She has Crohn's and colitis, and she's doing well, which is terrific. But suffice it to say, we've had a tremendous interaction with our insurance company, and overall it's been positive. Sometimes it can be difficult to access information from them or even get in touch with them. And as I understand it, my situation is not unique, that sometimes we're not sure where to go when we need to reach out to our insurance company. I fortunately speak the majority language, English.
Right.
There are many Californians that don't. And so you're looking to help folks that are facing challenges with regard to language and with regard to timely care.
Timely access.
Yeah.
So my SB 1035, it's designed to enforce existing law. We are, as Californians and under the Affordable Care Act, we're all entitled not only to have access to coverage, but to have timely access to medical providers. And so when a person has their health insurance plan, whether it's public or private, they usually have a medical card.
Right.
And that's what you present to the receptionist when you go to the doctor's office. What we propose is for that card to include a toll-free number to the oversight agencies, that if they're denied timely access, we tell them right on their card who you can call. Part of that timely access is, as you reference, is the right to interpretation if necessary. So with the evolving healthcare, the good parts of our evolving healthcare is we have extended coverage to many more Californians. It makes for healthier communities. The more people that have access to preventive care, et cetera.
So when you say timely access, does that mean that what does that mean exactly? There's an emergency and you need surgery right away and you can't get the pre-approval?
Right.
Explain.
That could be one example. Presumably, if it's an emergency, all policies have to cover emergency room access. One of the goals is that we invest more in prevention and try to get people out of emergency rooms. But let's say that you're following up from an emergency room visit and they said, see your own doctor, a week after this emergency room visit, and you phone doctors who are listed in your plan.
I knew you were going there.
And you can't find anyone who has an opening. And what this will force the medical plans to do is make sure they have sufficient doctors, providers in their network so that patients who are covered by that plan have timely access.
But let me ask you that because, look, I have dealt with narrow network issues with regard to my wife. And, while the Affordable Care Act seems to have been objectively successful in California, I'm not taking a position per se, narrow networks continues to be an issue.
It is an issue.
And so can this call center address the issue of narrow networks? That's tricky.
It can, because what the call center will do, first and foremost, it will take the information. So we have a catalog of if there are multiple complaints against a particular plan, that could go into some enforcement action. They will also help that patient navigate with their own plan, make sure, have you called your plan and lodged a complaint with them, so there's something in writing. Some people will just hang up and they're frustrated. I have to wait for 3 weeks or nobody will see me.
Will you come back and talk more about this because it's an important issue. His name is Bill Monning, Majority Leader of the California State Senate. We're in Sacramento. I'm Brad Pomerance. It's Local Edition.